Hey, how are you today? My name is Dr. Brian McKay. I'm a chiropractor in Darien, and what I'm going to discuss with you today is plantar fasciitis. We're going to talk about what causes plantar fasciitis and what can be done to treat plantar fasciitis. Let's start by explaining what plantar fasciitis is. First of all, it's a very painful condition that strong pain goes across the bottom surface of the foot. It doesn't always affect both feet. It tends to affect one at a time. People will typically treat it with ice, cortisone injections, bracing, rest, Aleve, a whole bunch of different things. A lot of times it doesn't work, but for the most part, the patients I see have already tried just about everything under the sun, and when they come to me, it's usually at the referral of a podiatrist or an orthopedic surgeon. So it's kind of strange to think what a chiropractor does treating plantar fasciitis, but our success speaks for itself, and we've been helping a lot of people. Now, the plantar fasciitis occurs when the fascia, which is the covering on the muscle, the very thin muscles at the bottom of the foot, become inflamed. Now typically I'm going to use a very simple analogy here. I have a plastic bag, and think of the plastic bag as being the fascia. It's a covering. Right now it's covering my fingers, but think of it as the covering of the muscle. So now when two bags glide, they should glide over each other. If I had two levels of fascia, muscles move, they're supposed to move nice and freely over and top of each other. Now what tends to happen is the shape of the muscle, okay, the shape of the fascia starts to change. And when that happens, instead of it being like a plastic Ziploc bag or a smooth bag, it becomes more like bubble wrap. So every time the bubble wrap goes on top of the surface of the muscle, it acts to inflame and it starts to change the shape of the muscle. Friction is created at a greater rate because there's more surface area with the bubble wrap as there is with the regular plain plastic. So as this continues to happen, the surface dries out, becomes inflamed, tender, and actually very, very painful. So my job is to identify the areas that are causing the adhesions to form in the first place. And a lot of times it's some of the muscles up or higher up in the leg and the calf, the IT band, or the hamstrings. So we treat the hamstrings, the calf, and the area where the fasciitis occurs. Now, the people who most likely get plantar fasciitis are going to be runners, sometimes tennis players, spinning, any activity where you're on your feet for a long period of time. And it seems to be that the stretch is not enough stretching in the Achilles or the calf area, and that leads to this problem from my estimation. What I'd like to do now is I'd like to show you an actual, brief part of a treatment and how it goes, so you can see how effective the treatment actually is. Come with me, let's show you that right now, okay? What we're going to do first is we're going to apply a topical lubricant to what we call the plantar surface. That's one of the reasons why we call it plantar fasciitis. And after applying that topical lubricant, we use a special tool, and you'll notice that the tool is rounded, but when we actually start to do the treatment, this is how the treatment goes. We rub along the plantar surface of the foot, and what we're trying to do here is remove those adhesions that I demonstrated just a moment ago. And now typically most of the pain in plantar fasciitis will be along the heel area, sometimes causing heel spurs, but in this case here, we're going to work just on these small muscles. There's a lot of small muscles that line the bottom of the foot. So we're doing this for demonstration purposes, and what we're going to do now is we're going to stop, clean up the foot, and then we're going to show you the laser part of it. Now, be so kind, pass me that laser, please. It's kind of hard to get the full effect, so let's just shut the light off. And what we'll do here is you're going to see the laser working. Now, what a laser does is these are cold lasers. The cold laser acts to stimulate cellular regrowth, because basically laser is just packets of light. So as photosynthesis will help plants grow, we're using cold laser to stimulate the cells to grow back in, because the Graston procedure is going to basically kill off that layer, the dead layer of cells on the outer surface of the fascia. So what happens is we get new healthy outer layer of the fascia, reducing the pain by removing the adhesions and starting cellular regrowth. This is a short and sweet part. The treatment takes itself just about takes about 35 minutes, and it's highly effective, and usually patients respond within a short period of time. About 2 weeks, they're back running again, not full level, but within 3 to 4 weeks, the condition's healed. And we've had people who've had plantar fasciitis for a period of years come in and get this kind of results. So if you're looking at the kind of results that we hope we can deliver for you, there's a link below, there's a number below. Get in touch with us, we'd love to help you. Thanks very much. I'm Dr. Brian McKay, Core Health in Darien. Have a great day. Bye.
Hi, my name is Chris Parrott. I am a big runner. Used to do about 30 or 40 miles a week. I've been to, before I came here, I went to 3 different podiatrists. Constant pain in my heel, constant pain the plantar fascia. Nothing worked. Like I said, 3 different podiatrists. The third one finally recommended I come see a chiropractor. I didn't know why I was going to see a chiropractor for something the podiatrist should take care of, but the podiatrist recommended the new therapy. I came here for about 3 or 4 months, 3 times a week. That was 2 years ago. I have not had the slightest bit of pain or discomfort since. And I continue to come here for regular updates and checkups, and I couldn't be happier. Thank you.